Bismillah ar-Rahman ar-Rahim. This topic about fetal death was called stillbirth. As definition of stillbirth, stillbirth is a term applied to fetuses born dead after the age of fetal viability. That's about 24 weeks gestation. Any fetus delivered dead after that age called a stillbirth fetus. Fetal death may occur before the onset of labor. That's called the antenatal postpartum death of the fetus. During the course of the labor, it's called the intrapartum death of the fetus. Antenatal intraparental death has different etiologies. It may be due to severe medical disorder with pregnancy, severe hypertension or uncontrolled diabetes mellitus, marked acute or chronic placental insufficiency, as in case of placental aspiration, placental abruption, or placenta previa, or multiple placental infarction, congenital anomalies of the fetus, true knocks of the umbilical cord, Erythroblastosis fetalis, placental vasculopathy due to immunological disorders like antiphospholipid antibody syndrome, or maternal infections like syphilis, chemical poisoning as chronic lead poisoning, or in many cases it may be due to defective etiology, become the sign of specific etiology of intraparental death. There is multiple pathological changes that occur in the fetus after its death. It will start by peeling of the fetal skin, and this starts after 12 weeks after the fetal death. This for medico-legal points, you must know what the changes. The peeling of the fetal skin needs at least 12 hours after the fetal death to occur, and then there will be softening of the frail tissue and absorption of the cerebrospinal fluid, leading to what's called the folding sign, the overriding of the flat cranial bones, make a folding sign, and this need about 1 week after the fetal death occurs. So we have two pathological changes. The first occurs after 12 hours at least after death, the peeling of the fetal skin, and the second is the folding sign, and occurs after at least 1 week after the fetal death. You can make a diagnosis of intraparental death from symptoms like cessation of fetal movement, regression of pregnancy changes, especially breast changes, breast milk secretion may be established, and cessation of abdominal enlargement, or even it may regress. The symptoms: by signs, the uterus will be smaller than expected from the menstrual dating, fetal heart sounds are not heard, and the fetus feels like homogeneous mass, and the fetal parts are difficult to distinguish due to loss of muscle tone of the fetus. By investigations, ultrasound will help greatly in the diagnosis of intraparental death by the absence of the cardiac activity of the fetus, and it may diagnose some etiologies of the intraparental death. If ultrasound is not available, the plain X-ray, it can detect many characters like the folding sign, hyperflexion or angulation of the fetal spine, gases in the fetal circulation, rarefaction of the fetal bones, collapse of the thorax, and detection of some causative factors of intraparental death. Also by investigation, by measuring the maternal urinary estriol, trying to measure the fetal estrogen, the estriol in the maternal urine, it will fall to undetectable levels within 48 hours after the fetal death. What the complications of intracranial death? If the fetus dies in utero, it may lead to intrauterine infection, and the great complication, but it needs a long time to occur, is disseminated intravascular coagulopathy. If it is retained intrauterine for more than 4 weeks, also amniotic fluid embolism will have an increased incidence if the fetus dies in utero. Most dead fetuses are expelled spontaneously within the first 4 weeks. So you must make assurance for the mother to stay at home for these weeks in the hope that the fetus will be expelled spontaneously without interference or intervention, either medically or surgically, to these cases. If the fetus is retained more than 4 weeks, or there is maternal anxiety, or signs of intrauterine infection, or signs of DIC is present, so termination can be done by using pitocin intravenous drip, prostaglandins by any method, either vaginal, intracervical, extraamniotic, intravenous, any method for instillation of prostaglandin to help in termination of pregnancy. Intraamniotic hyperphenysteran is obsolete method now because it has many complications, and surgical termination is extremely rare. Must be only done in cases with absolute indication for operative termination for cesarean section to be done in these cases. The intranatal fetal death or intrapartum fetal death, it can occur during delivery, during the process of delivery, that the fetus die due to asphyxia, birth trauma, intracranial hemorrhage, or severe intrauterine infection. So proper antenatal and intranatal care is a must to prevent these